Probably will not be nearly as articulate, but I hope that I can share with you a little bit about what's going on in healthcare today. I wanted to give you a little bit of an overview, on what the conversation is right now regarding healthcare in general, and then I'll share a little bit about cancer treatment centers in America. I'm sure you probably have heard that story a few times over the last couple of years. You know, there's been a real paradigm shift in how providers and payers view what we used to call the patient and now we truly call the consumer. You really can't depend on your primary care physician to lead you in the right direction for clinical and financial reasons. Things are really changing with the way that the insurance plans are today. You've seen your premiums go way up. You've seen your deductibles go way up. And so what does that look like for the next few years? The one thing I really want to share with you, and it's important for me to share with you today, and I hope that this is the one takeaway from today's meeting, is you are consumers and you really truly need to be involved in your healthcare decisions. You know, there was a time just a few short years ago that you could go to your local primary care doctor and he would refer you to a surgeon or a pulmonologist, or would send you down to a local imaging company to have your chest x-ray or your CAT scan. And that worked out fine. You would go and pay a small copay or a small deductible, and it was fantastic. You didn't have to worry about anything. Today, things are much, much different than they've ever been. There are high deductibles, there are high copays, there are high co-insurance costs, and in this time where the economy is not as stable and there might not be as many discretionary dollars in your bank account, we really need to be focused far more on what are the rules and what are the fine print in our insurance policies, and where can we go to get the highest quality care for the lowest dollar. And so one thing that the industry has done to respond to this is something called a consumer-driven healthcare plan. And I don't know about you, but our insurance company, our insurance options at CTCA as employees changed this year, and probably did for many of you all as well. We're all very used to the old traditional PPO programs, which were fantastic. They were fantastic for consumers, fantastic for payers, fantastic for providers, and worked well. But there's been such a huge increase in premium costs to employers. Thus, if your employer is going to pay more, guess what? So will you. So in the last 5 years, we've seen anywhere from 6 to 11% increase year over year. That's amazing, and that's scary, because I can tell you that the amount of your wages have not increased in like ways in the last 5 or 6 years. Things are not going to change. Costs are going to continue to grow at 6 to 11% year over year, and small businesses with less than 5,000 employees are growing at the highest rates. So it's very concerning. You know, for us, we did, at CTCA, we changed our insurance options to our employees, and what slid in this year for us, 2 years ago I had a PPO plan and I paid X premium. This year I have a consumer-driven health plan at the same premium. So what does that mean to me? My husband was in the hospital 2 months ago. The bills have come piling in, as I'm sure you're all aware, from hospitals and specialty doctors and the radiologists and the laboratories. And what has happened for us is that we've seen an incredible amount of high deductible and copay. Now that's okay if you go to the hospital because you're sick. You expect to pay a high copayment. But what if you're just going for your checkup or because you have a cough? And those are the types of things that, you know, we are concerned that people will start to neglect with the high deductibles and high copays. One thing that is most important for me to share with you is that payers are changing the way that they're paying providers, which is something that, yes, you do need to be concerned about. Insurance companies are paying providers now on episode of care payments. They're paying them based on what we call an accountable care organization, and they are incentivizing and paying bonuses to the provider, to your doctors, to your hospitals, in order to reduce the amount of care that's being given to patients. That's good, and that's scary. What's good for that is this. Hopefully we're going, in a quality model, we're going to develop a way to provide you high quality services without running the bills up with a lot of unnecessary tests. You may or may not have seen a lot on the news over the last 2 or 3 years about excessive uses of CAT scans. There's been a lot on the news that doctors have become very dependent on CAT scans. If anything in your body hurts, we'll get you a CAT scan, we'll look inside and we'll know what's wrong with you. Well, we need to quit being so dependent on those types of things that are available to us because they're high cost to the provider, to the consumer, and thus to the payer. And we need to get back to good old-fashioned medicine. So the payers are starting to reimburse or incentivize the providers based on good quality, but low utilization of high-dollar tests. So what does that mean to you? The one thing that I would really like to share with you is this. In addition to all of this, we're really requiring healthcare companies, providers, to disclose far more about their quality data than we ever have. So, and that's an exciting thing for me as a consumer, for my husband who was in the hospital, and really me as a provider of healthcare services, because we're excited to tell you and share with you the exciting high quality things we're doing at CTCA. But what's important for me to share with you is you need to research this before you get sick. Okay, you can go to hospital and physician websites and pull quality data. You can go to your insurance company's websites and pull quality data and financial data. And you can also go to third-party companies like the Leapfrog Group or Health Grades and pull that same information. Again, the one thing I really want to share with you is you need to find high-quality health care at a reasonable financial cost, and you need to make those decisions about who you're going to want to see, what facilities you're going to want to before you get sick, so you're not scrambling around at the last minute. At CTCA, has everybody been there or heard about CTCA?